To Inner Voice Show. On this episode, we're going to talk about relationship, finances, and a whole lot more. So stay tuned. Hi, I'm Dr. Foojan Zeine. I'm a psychotherapist. I'm an author and an international speaker. I have hosted my own television show, Inner Voice, in a satellite program for 16 years. Whether it's premarital counseling or through their marriage, how to deal with children, and if they're going through a divorce, to teach them how to communicate better together. In actuality, I think my job is very important to work with individuals and the couples in order to make the most important relationship of their life healthy, which makes them healthy. On my Inner Voice show, I actually interview some of the prominent psychologists and entertainers in English. And I also speak to some of the psychotherapists who are Iranians and the artists who are Iranians. And I speak in Persian to the Persian population around the world, from Iran or Europe or Japan, Australia, all over the United States and Canada, because obviously I was born in Iran.
Where's Dr. Zeine? Dr. Zeine?
Hello.
You also have been trained in my specific methodology and techniques, correct?
Yes.
Are you willing to talk to her after this show?
Absolutely.
And tell her the step-by-step that she needs to do to deal with what I believe is an addictive personality?
Yes, absolutely. The family goes through a lot. For boys who are becoming girls, the fathers of the family suffer. They will keep being confused. They look at all the childhood pictures that they've took of their son, and now they look at somebody who's standing in front of them and supposed to be their daughter. Coming up, I'm going to be talking to a psychotherapist about awareness integration model. You really want to know what that is, huh? Coming up. Stay tuned. Hi. I'm Dr. Foojan Zeine, psychotherapist, and I'm here with Nasreen Bafordari, licensed marriage and family therapist. We're going to talk about awareness integration model, a psychological model that I have originated, and Nasreen Bafordari is one of the first therapists who has actually learned and has been utilizing it with her clients. Thank you for coming.
Thank you for inviting me. This is an honor.
Some of the major topics that I actually talk to my clients who are couples are first talking about sexuality. Many people don't know how to talk about sex. Concept of communication about it is something that I actually have to teach the couples and how to do. We talk about sexuality. Many people come into their sexuality in a very automatic way. We can go through the whole experience and wham, have a great time, but being with another human being, it actually takes skills. So becoming aware of every area of how we think, how we behave, how we feel, how we communicate with another human being in order to have an amazing sexuality is part of what we also teach in this AI model.
So much of our sexuality.
People don't talk about finances a lot. They don't have a system. They come from two backgrounds of how they actually have created their finances, and I have to help them create a system and have a great communication in how to follow the system. Another main topic is when they actually have children. Now remember, two people, two backgrounds, two cultures, two sets of values are coming in, and now they actually have to bring those together, and that's where they need how to communicate, be flexible, and really negotiate on one way of handling their kids. Duet, sometimes you guys are entering each other's space and singing together, and then solo. How does that experience for you?
The funny thing is,
in-laws, we have to deal with them. They're always there. They're going to be there. We didn't marry them, but they came with the package. So somehow we have to really, really work with them. And if I have to actually add one more topic that I've had to deal with a lot of couples and individuals is addiction. Whether it's an addiction to alcohol or drugs, pornography, cell phone, computers is one aspect that really, really affects the person's life and in their relationship. With people who are going through recovery from addiction, they've had some sort of a trauma in their childhood. And when we've worked with the awareness integration model with them, clearing the trauma, the choice and the chance for them to relapsing is really minimized. I have been in the field of psychology for about 25 years. I started with seminars in ontology and psychology almost the same time. And I know you were part of the pilot study that we did, and in the result of that pilot study was that people were actually minimizing the depression 76%. They were minimizing anxiety 64%, and their self-esteem was rising about 43%. Now those are astonishing numbers.
You know, I wanted to go through it. I wanted to experience what my client would experience. So I asked you to work on me as a model for the group that was being trained.
Hey everyone, thanks for watching. If you like what you see, you can see more on my website and my YouTube channel. And if you want to contact me, I'm on Facebook and Twitter. Bye-bye. Hello, I'm Dr. Foojan Zeine, and welcome to the Inner Voice Show, the show that's about you and all that matters in your life from a psychological perspective. In this show, I speak with experts in the psychology field, and today, I'm very excited to have Dr. Scott Miller with me. Let me tell you a little bit about him. Dr. Scott Miller is the founder of International Center for Clinical Excellence, an international consortium of clinicians, researchers, and educators dedicated to promoting excellence in behavioral health services. Dr. Miller conducts workshops and trainings in the United States and abroad, helping hundreds of agencies and organizations, both public and private, to achieve superior results. He's one of a handful of invited faculty whose work, thinking, and research is featured at the prestigious Evolution of Psychotherapy conference. Dr. Miller is the author of numerous articles and books which are on the screen as you see it right now and can be found on his website, www.scottdmiller.com. I'm so excited to have you, Dr. Miller, with me at my show.
Thank you, Foojan, and please call me Scott.
Sure. What I wanted to let you know, which you probably didn't know until I just told you, but the audience doesn't know that. I really wanted to share that many, many years ago, I think it was 2003 or 2004, where for the first time when I was writing the book Online Therapy, I was looking at the different kinds of masters and theories that help the brief therapy and how to effectiveness of therapy, especially because online therapy was new. And I remember I called you, and you, for the first time, I looked at the model that you had presented for therapists to really look at how we can do therapy effectively and know that it is effective versus just kind of like have this guesswork. And I remember that as you were talking to me and my co-author were sitting there explaining in how you brought this model to presence and why and behind it and how you had brought it in, I just had tears because it felt so close to my heart with the respect that you were considering for the client as they come. I know in the medical model, many times, the clients are being utilized as, okay, you're a lab work, or you're a subject, or you are this disease, and you are all these symptoms. And the way that you were approaching, looking and asking and allowing this process for the client and the therapist to bond them within the therapy session, it was just a beautiful essence to it. So I want to first of all thank you for that, and then talk about the model and what brought you to think about that type of a model for effectiveness of therapy.
Well, thank you very much for that, Foojan. It's a great memory to have, and our team, I feel like, has been very fortunate to have people like you and also clients be interested in the ideas that, my team and I have worked on over these last 20 years. I think the real main reason why our group succeeds is that we've been interested in improving the outcomes of psychological treatments, which, by the way, are really very good. You know, if you watch the television news, there is always some story about the current crisis in Americans' mental health, whether it's the heroin epidemic in the Midwest or other problems in other parts of the country. All of this really distracts from a really important point and finding. Over the last 40 years, the research literature on psychotherapy of virtually any kind that's been tested for any particular problem that people present with, it shows that talking about your problems with a professional is really very effective. And again, my worry is that it's easy to get distracted from that, both distracted by the amount of information and yak about problems, but also simply by the gush of information about mental health services. Which approach do I use? Which therapist do I use? Which book should I read in order to get better? And so our team really first starts with the fact that treatment really is effective. The most important part is to get into therapy if you're having a concern, and it doesn't have to be long. It can be 1, 2, or 3 visits and be really quite effective. I wish that Americans and the field thought of therapy like they think of dentistry. That when you have a concern, you go. And you also have regular checkups. It doesn't mean you have to go for years and years and years. Of course, if you do and it's effective, that's great. But most people could really benefit from a session or two every now and then.
I agree. I've actually had the experience that after a client has come in for 6, 8, or 12 session, which they've handled something that they wanted to handle, whether it was a crisis in life or a transition in life, and they've chosen to continue to come once a month, let's say, once every other month, and they've continued that in their life, they've worked in a very proactive way where they did no longer create crises in their life, and they were consistently on top of management of life and what was coming up before it actually got into crisis.
And you know, what's interesting about that, Foojan, is that the research literature, and that's really what our team is known for, looking at the research literature without trying to support any one particular approach or profession, and finding out what it is that works. And what we do know is that if the therapy that you are having with a particular therapist is working, a little more of it is better than a little less. We think that way naturally about our other healthcare professionals. If the insurance companies paying for the services allow us, we want to have a relationship. We want to have it go over time. We want somebody who knows us. So being able to check in occasionally, once a month, like you say, once every 3 months, once every 6 months, is much better than simply treating therapy like surgery. You come in, we cut out your problem, and hopefully it never recurs. The most helpful work occurs with an ongoing relationship.
One of the things that I noticed with the model that you have created for the therapist, where there's a questionnaire about when a client comes into the room, they kind of write down how it was for them the past week or 2 weeks if they were coming every other week, and they give a way of their explanation of how it was, and then at the end of the session, they also rate their therapist. Not in a way whether the therapist was good or bad, but if there's 4 different questions and subjects that they can rate the therapist, and then out of this rating, which happens every session that they come in, it becomes a conversational piece about the dialogue that can actually be there between the therapist and the client, more so for the client, so that they are part of and responsible and also accountable for their voice and what their needs are in therapy, which almost none of us therapists can assume, and all we do is assume. So this effective method really helps the client. Now, I know that our audience can be therapists, mental health specialists, and people who actually go and see therapy. If you could give a couple of sentences to the clients who choose to go to therapy, and how could they actually make this session more beneficial for themselves? How could they be proactive about what they, communication with their therapist and how it works for them?
Okay, these are really good questions, and it assumes, of course, that the person has a choice about the particular clinician that they go to see. But the best advice, I think, when choosing to see a therapist is that you interview 2 or 3 prior than making a choice. And the reason for this is that not all therapists are created equal, meaning that not all therapists are equally effective. That's one thing. We know that. We know from a great deal of research now that some clinicians are more effective than others. The second thing is a lot like relationships in general. Since the core healing ingredient is an engagement with the helping professional, you have to find somebody that you feel comfortable and can work with. As commonsensical as that seems, it's often ignored by both clients and therapists. And so you need to interview somebody, find out, does it feel comfortable? And then secondly, realize that not all relationships are created alike either. And simply because that person has a PhD or an MSW or a license to practice doesn't mean they'll be effective in helping you. You need to find somebody that activates you, that inspires you, that gives you hope, that makes you want to work at the issues and concerns that you have. And to that end, clients can use these measures together with their therapist. There are 2 simple ones. One measures progress. The client fills it out, as you say, each visit, trying to figure out, am I moving forward in terms of how I feel about my life and my concerns or not? If you're not moving forward within a relatively brief period, now this may be shocking to some clients, may even be surprised to therapists. What we know is that change in treatment, if it's going to occur between a particular therapist and a particular client, it should occur sooner rather than later, within a handful of visits, not within a handful of months or years. If you're not seeing some progress, this is something you should really address directly with your therapist. If the therapist you're working with attempts to blame that lack of progress only on you, then what you should do is nod nicely and get away and find somebody else. Because what you need is somebody who will inspire you, work with you, create that potential in the relationship for a better life outside of the relationship. The second piece is you can get some clues about is the relationship that you have, and the second scale, as you said, is administered at the end, and it's called the session rating scale, and there are lots of these types of measures. We only make one available. It is free to clinicians if they want to download it from my website. But this particular measure is based, again, on a lot of research over the last 30 years about what clients have to feel in a session to make progress. What do they have to feel? Again, none of this is rocket science. They have to feel understood. If you don't feel like your therapist understands you, work harder at helping them understand you. And if it doesn't result in understanding, again, you have an important decision to make about whether or not to continue. The second thing is, you feel like the therapist is willing to address what you came in to address. They're working on your goals. This is perhaps the most important part of the therapeutic relationship in terms of effectiveness, that you and the helper have to be in agreement about what it is you're there to work on. The third piece is that the approach that's used, the therapist's way of working, whether that's to have you talk about your dreams or to set very specific goals, to monitor your thinking, whatever it is, you have to be in agreement as a client with that method. It has to make sense to you. If it doesn't make sense, talk with your therapist about it. And last, the last question on the measure is about whether or not the therapy feels complete or something is missing. Therapists aren't mind readers, otherwise they wouldn't be in a therapist's office, they'd be on the Psychic Friends Network. So therapists have to be told if in fact they're missing something important on occasion. I am so impressed with therapists most of the time. They are a truly perceptive lot. It gives me chills to mention it, to watch a good therapist work with a client. But we can't be all things to all people. Occasionally we miss stuff. And the measure gives the client an opportunity to say, you missed this and that's important to me, in a face-saving way for both people, so that that can be addressed in subsequent visits and sessions.
The first one that you were saying about the whether a client feels that they can connect or that they've been heard or that this has been actually movement into the therapy. I think that many times clients won't see the movement not necessarily because the movement hasn't been there. I know that, and I know you have gone through that, where when you work with someone who's really, really depressed, or have gone with someone who's very, very anxious, the amount of, maybe in their mind is, if they're coming to therapy, that it should consistently, just the day that they feel everything is great is when they're no longer depressed or never feel anxious again. So in their mind, there might be no movement until they get the final result, because that's how they've been set up, or they feel hopeless, so hopeless that anything that is changed doesn't matter unless they get to that perfect place. And they feel disconnected or disappointed, and sometimes leave therapy without necessarily acknowledging that there was change. This is the opposite of, like, the other side of what you were also explaining. But I've also found that because of the way that the system of the form works, that it allows the client to actually talk about it. And I've had many times where the client says, well, I've come 8 sessions, but I don't know if I've seen any changes. Have you? And then it's given me the opportunity to sit down and go over exactly all the changes that has actually happened in every area of their life that actually I see, and give them a reality check on that, where then they say, oh yeah, it has. And then so therefore I ask, then how come with all of these you still think there hasn't been any change? And they'll say, because I've been zooming and only wanting this change in this particular area or this way, and so I'm missing all of the other changes while I'm only looking at this one not happening. But the beauty of it is that the mechanism and the forms and the ritual that it creates for the openness of the client to have the ability and the means, the venue to say and give this feedback without feeling shy or embarrassed or thinking that they're going to scold a professional, or, you know, sometimes we have this relationship which our therapist becomes our mommy or daddy and we don't want to get them upset. And the way that these mechanism works really supports the client with this ritualistic concept that just gives them the right. And when they feel that they have the right, then it's beautiful for us as therapists, because we're there to help. And the more information we get, it's better for us.
Sure, absolutely, and there is sort of a looming finding in the research literature that you kind of highlight in your comments, and that is the percentage of people who start but then discontinue treatment prior to achieving some real improvement in their functioning or their well-being, and that figure ranges between 20 and 80%. A reasonable estimate of the number of people who discontinue without feeling like they got much out of it is around 40 to 50%. And hopefully what the measures do, or this constant reviewing of the progress from visit to visit, is give the client an opportunity to share that concern so that the therapist knows. Once again, although I'm always impressed with how sensitive most therapists are, we're not mind readers, and this gives an opportunity for the client to really fill in the gaps for us. You know, I don't feel like I'm making progress. That's the important step. It gives you a chance to clarify, potentially point out changes, or even say, you know what, you're right. It isn't going the way it should go. Let me think about what we should do different.
It's amazing when you say about us being perceptive. I thought I was very perceptive, and I know that I am, and I know that I'm an effective therapist based on, you know, the feedback that I get. But amazingly, with a couple of clients when I was doing this measurement, the sessions that I thought I just did a great job and the client did an amazing job, and at the end of the session I'm like going, this was just such a great session, and then they did this and it's like, and they wrote, well, I didn't get this or that. And then some sessions which I thought it was really like I wasn't effective, the client is not feeling good, they really didn't get anything, and much, you know, it didn't happen in here. Then suddenly they write this, and it's like, it was excellent. They wrote Hakam and what they got, and I was baffled. Why, like, wow. Yeah. That although we really get trained to read cues and listen and all of that, every human being is so complex that unless they actually have the opportunity to share with us what's going on with them, we are still going to miss so many percentage of what's in reality as an information there, which is important in that relationship.
Yeah, and I think that if we're not perceptive, we are, for the most part, again, there are always a few bad apples, good-natured. We want to do right by the person. And so having the tools can give the client and the therapist a chance to overcome their differences. And I'm impressed by the diversity of people that are now entering treatment services for the first time. And hopefully the tools give us a way to improve our ability as clinicians to meet the diverse kinds of people that are entering services, different ways of being in the world, different world views, different backgrounds, different cultures. All of these things are important for us to embrace and learn how to convey understanding,
right?
How to get them.
Scott, one of the important factors, and I know that you've done a lot of research on different types of modalities, different types of therapeutic approaches and interventions and how effective they are and they're not. And for the audience, you can definitely read Dr. Scott Miller's articles in his website, which is showing on the screen. What is the real expectation of therapy when a client actually goes to therapy? What should they be expecting? I know that one of the first questions I ask someone is, "Have you ever been to therapy?" And if they have been, then I ask, what did you like and what you didn't like? And if they haven't, then I ask, what is your expectation that, what was in your mind before you came? What have you heard about the therapy? But if you, from a clinician who has been working on the effectiveness of therapy and have done research and seen research, if you could give us a light about what should we expect from therapy?
Well, you should expect it to help you with the concerns that you have, period. Mm-hmm. That's for you to define what it is you're coming in to work on, and that the therapist works hard at helping you make that happen. That's what you should expect. And you should expect that if it's going to be helpful, you should see progress sooner rather than later. Generally, in the research that we've done and others have done, if you're not seeing any improvement by the 5th or 6th visit, the chances are diminishing that therapist will help you by extending what they do. So that therapist either needs to change or augment the service with something else. And that goes not only for talk therapies, but it also goes for drug therapies that are used in mental health services. If you're not seeing some benefit sooner rather than later, you probably really need to consider augmenting or changing what you're doing. So I would say that clients should expect to feel understood, to have what they came to work on worked on with an approach that makes sense to them, that fits them. And if it doesn't, it may not mean anything bad about the therapist. It certainly doesn't mean anything bad about the client. It just may mean that this isn't the therapeutic relationship for you. And you may have to go through 2 or 3 people before you find somebody that really fits for you. Mm-hmm. So I often say that therapists are not all created alike. They don't offer the same thing to everyone. And even if therapists are trained in the exact same approach, their effectiveness rates vary. So you need to find somebody who really fits and works for you. And unfortunately, at the present time, that burden is really borne by the clients. They have to contact, they have to interview, they have to go see somebody and see how it fits.
And if you were going to tell the therapist, which is something you consistently do in your workshops and conferences and the consortium that you're creating, what is it that you would want the therapist to know about your model, and why does that model work? Beside what we just said to the clients, but therapists also have a huge responsibility in how they conduct. They're the one who know this field. They're the one who are an expert, and they're the one who set the goal and set the realistic, let's say, goal with their client as they come in, and show their frustration or state their issue or problem, and kind of even state what it is they want to get. Usually it's the therapist that works with them and brings it into a realistic space of what we can work on and how long does it take and what we can do and what we cannot do. What would you like to tell the therapist about the effectiveness of your method and model and how it can be used?
Well, there's a very large research study that was done for over a 10 or 15 year period that was published by two researchers, David Orlinsky and Mikkel Runnestad. Mikkel Runnestad is from Norway, David Orlinsky at the University of Chicago. And they looked at therapists' development over time, their professional development. Do they get better? And the key findings, there were two. And the first key finding is that therapists really want to develop professionally. And number two, they invest huge amounts of time and effort. They go to continuing education workshops, most of them. They read, they think about their clients, etc. So they really do want to develop. Let's put that together with some other research that may be more disturbing and perhaps upsetting, and that is when we look for evidence that therapists actually improve in their effectiveness over time, we don't find it, frankly. And the reason is that once a therapist has achieved basic proficiency at their craft, in order to get better, they have to focus in a very specific area, and that specific area is when they're not helping people. So you can't get better by learning new techniques and new strategies and reading books if you don't have a goal, and that goal is focused on dealing with your mistakes and shortcomings. That's true of life in general, and it's true of therapy specifically. Now we have a fair bit of evidence to show that the better therapists in our field actually devote much more time at working at their edge, identifying the sessions and the clients that they haven't helped, and really focusing on improving their skills in that particular area. In order to do that, you have to do what we talked about at the beginning of this interview. First, you have to measure. You have to find out who you're not helping and what types of concerns or problems that you're not as helpful with. And then you have to do some targeted work that's called deliberate practice at improving your skills. If you don't do deliberate practice, if you're not taking the time to highlight your weaknesses and then practicing at getting better, you're going to stay the same. Curiously, what often happens is, and this is not just true of therapists, it's true of professionals in general, they think they're getting better. The longer they work in a field, the more confident they become, but the more average their results are. So to stay frosty, you really do have to highlight those shortcomings in your work.
I know that with my own experience, as you were talking, I was reviewing some of the work that I have done on myself, and it was interesting as you said it. I know that the model I created, awareness integration, it happened a lot with the same thing you're saying, where I would be doing some deep work and then I would feel stuck where the client was stuck, and it was almost like I didn't have any methodology to move it beyond that. And I got it that I'm stuck here and there's nothing else that I can do. And learning a lot of the other methods and bringing and zoning in into really opening that part. So it actually invented new ways of handling, and this is just what you just said. I would go onto the edge of what I needed to do and try to go beyond it. And it really helped me in that. And then I was thinking about, sometimes I, as a therapist, also get so zoomed in one area that at times I kind of like let go of the other areas, because I also, and I know you do, we supervise other therapists and interns, and so when we're working with them, you could see how they're working and how I also work. And one of the interesting concepts was, for a while in my practice, I was so much into the techniques that I was using that I would get boggled down with that and then forgot about the compassion part. And then when the measurements would come in and I'm like, my God, I'm so efficient in this work and I'm doing this technique so well, but it just wasn't landing for people because the compassion wasn't there. So it's so interesting about how getting proficient, getting better, and getting effective, it has its dynamic and it has its progression where, like you said, when the therapist really looks at any human being in their life, when they look at how much I've come forward, what are my skills, what are my best things and that I have in my life, and what I'm good at, and then when is the edge that I'm not good at, and then as I raise this edge and expand it, what am I throwing out and not necessarily considering to be in, versus as I expand, I lose some things, and how can I be aware of having all of those? So as you were talking, those experiences came up for me.
Sure. And, we find that the better therapists devote about nearly 3 times as much time outside of their practice in reflecting about their shortcomings and their errors than their more average counterparts. So it's a significant investment. But the key is balance, of course. That doesn't mean that they're not focusing on the rest of their work, but they're targeting those areas where there is some kind of weakness in the approach, stuff that they don't do well, right at the edge of their performance.
So when we're talking to the therapist, as they're utilizing this tool and the method with their client, this tool really helps the relationship in a particular way. Can you also talk about the dynamic of the relationship that gets created and promoted within this conversation and dialogue as the therapy goes along, week after week, and the differences that we see, for example, from the week first to second to third, in the way that the communication happens when they're doing this, when they're talking about the actual session and the forms?
We've done several studies that looked at how the relationship develops over time. And when you say a relationship, it sounds at one level so very good and at another level so very vague. So when we research this topic, we're talking about something quite specific. 3 basic components: agreement on goals, agreement on the means that will be used to achieve those goals, the client's preferences, that the therapy seems to fit their values, their culture, their background, and the therapist's role, meaning what's the therapist supposed to do in relationship to those other 3 elements in the alliance. And as you say, humans are very diverse people, both the person providing the service and the recipient of that service. It's amazing how health therapy works, given the sheer difference between most providers and their clients. But it really does, except when it doesn't. And curiously enough, that's where the opportunity lies. Number one, for professionals to develop. If I can find out where I don't connect with a client, now I know where my edge is. If the client will tell me that I'm not providing a kind of service that fits their goals, that helps them feel understood, that fits their particular preferences, that is delivered in a way that they want it delivered. If I don't do that, and I can get the client to tell me that, especially early on, those therapy relationships have better outcomes. So let me say that in more plain English. If a therapist can get a client to complain, to say, the suit that you're sewing for me pinches me a little bit here, would you please let it out? The client ends up more satisfied and has an improved result. Again, this is just sort of common sense. But many people won't complain. Many clients won't complain. They leave with the suit that's pinching them a bit for whatever reason. They don't feel like they can share. They feel like the tailor might kick them out. They feel like, well, everybody else has a suit that looks like this. Maybe this is the way it's supposed to be. No, the suit is supposed to fit you. The therapy is supposed to fit you. So if it doesn't fit, and the therapist can create an atmosphere in which the client can say, it pinches over here, the shoe makes my toes funny here, that therapy has a much better chance of a successful outcome. So over time, you want the therapist to accommodate the services to better fit the client. That leads to more engagement. You feel happier. You feel more excited as a client. You feel more on track. And as a result, you get a better service and a better outcome.
Scott, I know that you have done this research in many, many, many countries, and the forms have been translated to many different languages. Have you found the multicultural differences or the diversity of the population who use this, or in different countries who they're using these methodology, they're having a different way of handling it or relationship or the different way of presenting it. Because I know I work with diverse population, and one group of population that I work with is Iranians or Middle Easterns. And Middle Easterns and Iranians, like you said, it's not that they don't complain, they consistently complain, but when they come in front of an authority or someone who's supposed to be, for example, having a good relation with, part of the cultural perspective is that you never, in front of them, complain in their face. You might walk out the door and complain to somebody else, but culturally that's just not very appropriate. So what have you found in cultures such as that, or maybe Japan, or many different cultures, which talking straight to someone about something you don't like is not an okay thing?
Well, the measures have been translated and applied in 23 different languages. All of the Western and Eastern European languages, in Asia, Indonesia. There are some translations that we've had recently into other languages in the Middle East. And we have data enough data where we've been able to compare the responses of people, say, from one country to the next. And so far, we don't find any difference. Part of that is a function of the measure. It's not, it's 4 items. It's not an exhaustive assessment. It's a quick snapshot designed to help you check in, as opposed to really answer every question possible. At the same time, this triggers for me a fundamental principle of the work, and that is, I don't view people as a representative of their culture first. I view the person as a person within their culture. And within each culture, people are diverse. And so I really want to hear that individual first. So if we say Japanese fill it out this way, or Iranians fill it out this way, I always say, which Iranian? Which Japanese person? And once you get down to that particular level, the difference between people is greater than the similarities. Mm-hmm. And certainly there are unique ways that individual therapists working with different groups find for eliciting the feedback. But we don't see major differences in how people fill out the form. What we do see is major differences between how therapists get clients to fill out the form. Mm-hmm. In other words, some therapists are much better, given their cultural knowledge, cultural competence, at helping the clients feel like this is the place to share how you feel about this. It's okay. Does that make sense?
Absolutely. And I know that at the beginning when I was using the model, especially with the Persian population, I remember as I gave it to them, and even when I explained it, I used to get all high scores consistently. I mean, I love to, my narcissistic side thinks, okay, I'm great. But however, I knew that wasn't the purpose. So I started explaining that this is not an evaluation of whether you like me or not, or if I'm going to get upset, or even if I'm great or not. This has nothing to do with that. It's really about your experience and allowing yourself to share it with me so that I can be more connected to you and have an understanding. And it seemed like that type of explanation started, kind of like and then once or twice they would test it to see if it was okay, if they said something, but then they would get shy about it. And I think the more that the trust got created within that conversation, that they really they were allowed to say anything they wanted because this was their session, and that whatever they said, it was being taken with respect and attended to. Then it was easier for them just to feel honest about it and write it. But it took that bit of change to shift that element of what I call the cultural piece of a ritualistic way of handling things at the beginning versus, getting more trusting that I can say whatever, and this tool is for that purpose. And when they got that the purpose of the tool was that, then they utilized it appropriately. So I get that the explanation that we as therapists give in that scenario really supports and helps.
I'm thinking of two things in response to your comments here. And the first one is to warn clinicians who start to use the measure. If you go to the website and you download them, which again you can do for free, and there are 23 different languages, most therapists will email me or go on another website, which is the ICCE, the International Center for Clinical Excellence website, which is a social network for clinicians to talk about these ideas. They'll say, well, it doesn't work. And when I say, well, what do you mean it doesn't work? They say, all my clients score me high. And I will often respond in a way that I think creates a bit of anxiety, but also rethinking. I'll say, it's working perfectly. The clients don't feel safe enough to share the information. You're not inviting them in the right way. You can tell when somebody says, well, how are you today? Whether or not they really want you to tell them, or it's more like, how are you? Now let's move on. It's the difference between those two things. Is this really a moment for reflecting? And as you say, you stuck with it, Foojan, and you pushed yourself. You didn't say, my clients are lying, my clients won't give me feedback, my clients are resistant. You said, how do I need to ask this differently, though this person feels like I really want to know? That's the first piece. Let me just mention one other piece, and that is we have a big study we've just looked at with top-performing therapists. It's therapists who get outcomes that are head and shoulders above the rest of us. And, of course, our interest has been, what is it these people know that we could potentially learn as more average practitioners? And one of the things we found is that these therapists admit to more often being surprised by clients' feedback. Now, let that sink in a minute. They're more often surprised. What that says to me is this, that average therapists know stuff. I've heard this before, I've been there before, know it exactly. And there's some comfort, perhaps, to reacting to clients in that way. But a best therapist says, really, and is curious about the person. That's the difference. One person really wants to get to know you, the other wants to treat you. Well, I don't want to be treated. I want to be understood. So as soon as I'm understood, then I'm going to trust that they're going to do stuff to help me.
There's really a beauty in what you just said, which brought the tears the first time I was listening to you. It's that curiosity which probably created each one of us to want to be a therapist anyway. And somehow, hopefully we won't lose it in the middle to become experts. But also, as every human being, that the place in us that wants to be seen, wants to be heard, and wants to connect, but connect as the individual, not as a herd, as a part of the society only, but as the individual. For somebody to be so interested in me, I think that good parenting, if someone had the good parenting, they probably experienced that as a child when their mother or father at the beginning was really interested in everything that they did and who they were becoming. The ones who didn't have good parenting probably yearn it and need it and really want to have it. So this beauty of being curious, knowing who the client is, wanting to know every aspect and details of how they think and how they behave and who they are, creates that beautiful ambiance for the client also to get interested in themselves, also be able to see who they are and what is it within their system that they can get excited about and move toward and move and shake and maneuver or manage or flourish. And that piece that it becomes two people in the room that are excited about one person is the essence of that. And as I remember, it's like, when is it the first time we ever experienced, or even the last time we really fully experienced that, is probably when we were infant and a toddler, where we walked in the room and we were so cute that people would just leave everything and everybody would get excited about the infant or the toddler. And as we grew older, we just kind of lost that type of an attention. And it really brings us back to ourselves and creates that excitement and creativity and the essence of the person really wanting to connect themselves to themselves, because that ambiance is there.
Right. Right.
Wonderful.
Yeah, absolutely. Yeah.
Last words to whether the audience, whether they're clients or therapists?
Well, I was just thinking as you spoke that something I sometimes say that feeling understood, which is a crucial first step, I think, in being able to change. But feeling understood, feeling like someone gets you, is so rare nowadays that we often move in with the first person who does it or seems to do it. But again, my experience is that therapists, for the most part, really want to do that, and that you can find out if your therapist is doing that by filling out the measures. It's a very simple process. And I find therapy such a gift. I would dare call it a luxury, without meaning that it's. I don't mean to imply that it's not necessary, but it can be a luxurious kind of experience.
Absolutely. Well, thank you for
My pleasure.
Granting me that and coming to my show. And I hope that as you have more research and more books that you've written and you would like to share it with my audience, that you would join me here. And thank you. Thank you for being with me.
More than willing, Foojan. It was really nice to speak with you, and I hope that the information presented is well received.
Thank you. And also, if you are someone who has been going to therapy, has not been going to therapy, and if you wanted to also be proactive and actually take on this measure, you can actually go to the scottdmiller.com, download it, and take it to your therapist and say, hey, I've learned about this. Can we use it? And all of you who are a therapist and a mental health practitioner and expert, please go to scottdmiller.com. Look at the measurements, download them, and you can also contact Dr. Miller through that. And thank you for being with us. And until next week, create a wonderful world for yourself.